Historically, people talk about something called a Mediterranean diet. People say, "Oh, you should eat a Mediterranean diet," and they think that it's a magical thing that people eat a Mediterranean diet and the risk factors improve. It turns out it's not a Mediterranean diet. It turns out it's a Mediterranean lifestyle, which is directly related to lifestyle issues. It's light, mental stimulation, social partners, connecting with nature, physical activity. It's all of those factors that are just as important or more important than the diet alone. So it's a group of factors, and it's really a Mediterranean lifestyle, not just a Mediterranean diet. And this comes right back into lifestyle coaching and doing it correctly. It's strongly correlated with psychiatric issues and social determinants of health. The more dysfunction that you have from a metabolic standpoint, the higher your pain levels, the more catastrophizing you have, strongly correlated with smoking, the lower your socioeconomic status. There's all kinds of other factors, and all of these social determinants of health deteriorate with severe metabolic dysfunction. The metabolic disorders precede the high blood pressure. They precede the heart disease. You have metabolic disorder first, then you get the other things. Like, for example, people talk about, oh, if I eat salt, my blood pressure goes up. Well, that's true, but only to an extent. The reason why the blood pressure goes up when you eat salt is not because of the salt. It's because you already have high insulin and it affects your prerenal tubule, and you have too high of a glucose. And when you have a high glucose and your insulin goes up, you retain water, and the sodium only amplifies the effect. So there's a lot of mismeasurement that gets done, and there's a lot of conventional wisdom that's wrong. So normally, if you're listening to a patient, you use a stethoscope, or you're going to look at an EKG, or you're going to use an ultrasound if you're looking at their heart. For the purposes of metabolism, Measura is that tool that allows you to measure. And if you can measure it, you can manage it correctly.